Okay, so this topic is focused on nursing informatics and research. Basically, it will answer the question, how can we use nursing informatics towards research? Okay, now, it talks about computer applications that would support nursing research. Let's start by defining first research. No? When you talk about research, the key word always that we say is that research is a systematic process. We always say that research is a systematic process. Meaning, I could not say that I am doing research by just searching at Google. I could not say that I'm doing research by just mixing some chemicals. I could not say that I am doing research by just talking about it and not doing anything about it. Because when you talk about research, it is a systematic and scientific process. Okay, that's one thing that we need to remember. So please refrain from saying that, classmate, let's go to Google and let's research about COVID-19. Going to Google and searching about the topic is not research. Okay, we need to be clear with that. When I talk about research, research is conducting a study using a systematic and scientific process. When you go to Google and search about COVID-19, you are not doing a research about COVID-19. You are just doing a search about COVID-19. Okay? So iba yung research sa search. Kung pumunta ka ng library tapos gusto mong magbasa about infectious diseases, that is searching the library, not researching in the library. Okay? Because oftentimes, kadalasan sinasabi natin, uy, punta tayo ng live, let's do research. Okay? You could not do research in a library over 1 hour to 2 hours. Okay? That's one thing that we need to remember. Now, in research, you perform systematic and critical review of literature, and the purpose of that is to build a strong knowledge base and to determine the gaps and inconsistencies. Sige, para mas maging clear yung ating discussion, can you give me examples of researchable problems? Anything that comes into your mind na parang gusto mong i-research, or any topic na feeling mo major problem ngayon. Can anybody throw it on chat? Any topic that you can think of. Nursing research. Let's talk about nursing research. Sige. Any topic, any random topic that came into your mind when you heard the word research, or any topic na feel mo, oy, itong problem na to, dapat i-address natin to. Isa itong malaking problema ng Pilipinas na dapat nating ayusin. Yes, yes. Sige na, I would want to hear your ideas. Don't worry, you will not be graded on your answer, but you will be graded on your participation. Sige, kahit sa chat lang. I'm waiting. Okay. Nurses' perception about their salary. O, ito may hugot. May kakilalang nurse itong isang to. Okay. How about others? Sige. So that to focus on salary alone might be a little topic, no? Okay. But let's say, for example, the benefits and compensation of nurses. Okay. Let's talk about the benefits and compensation of the nurses. Okay. Sige, nakita ko yung pangalawang topic na na-send. It talks about perception of students towards K-12. Magandang problem siya. Pero if you will be doing nursing research, it's not the focus of nursing research. Okay? Pero again ha, magandang problem siya. Kasi marami namang nagsasabi, sayang lang yung K-12. Sana nakapakas na I was able to marry na, I was able to have kids na. And then, biro lang. Kadalasan yung sinasabi nyo, di ba, is sana professional na kayo, di ba? Sana professional na kayo. Okay? But then again, it's not the focus of nursing research. Okay? I would like to add a very important adjuncture to that. When we talk about nursing research, make sure it's something that the nurses can work on. Okay? It's something that the nurses can work on. For example, if Ray Ayan would be interested to work about the effects of mahogany extract in the wound of the patients. The question is, as nurses, are we the ones preparing or making the medications? Hindi. Hindi tayo yung gumagawa ng gamot. Tayong nagpre-prepare ng gamot, pero hindi tayo yung gumagawa ng gamot. And the next question perhaps is, are we the ones who can prescribe the mahogany? Hindi. Hindi siya focus ng profession natin. Okay? So later on, when you will be making your research, one thing that you need to remember is that will this impact the nursing profession? Okay? Nursing profession po yung focus natin. Kaya wag mag-focus sa mga blood extraction, wag masyadong ma-focus sa mga culture and sensitivity. Okay? Those are nice researches if you are into high school, kasi general ka pas nung high school. And those are good researches if you are in the medical technology. Pero right now, since you are in the nursing profession, your research should be focused in the nursing profession and its clientele. Okay, now let's go back to the example given by your classmate. Okay, and I enhance it to talk about benefits and compensation of the nurses. Class, the first thing that we do in research, or the first stage of research, is what we refer to as your conceptual phase. In the conceptual phase, we first define the problem. Okay, and in the words of your classmate here, parang I can hear that may problema tayo sa salary. Parang feeling siguro ng nurses, kulang yung salary nila. Parang gusto naming mga nurses, lalabas na lang kami, pupunta abroad kasi napakahina ng pera dito sa Pilipinas. That could be a problem. Okay? That could be a problem. After that problem, guys, the next step that is being done after reviewing the problem or defining the problem, the next step is review of literature. We review the existing literature. And what is the purpose of reviewing the literature? To know what is already known about the topic. Baka, for example, may na-research na about that. So what's the purpose? Bakit mo uulitin? Although okay lang naman na ulitin yung isang research, pero dapat may rational ka kung bakit mo siya uulitin. What is already known? What is not known about the topic? Okay, and what do experts say about this topic? What are the questionnaires available for the topic? What are the instruments available for the topic? And basically lahat about that problem. We do the review of literature. And after the review of literature, pwede pang i-change ang problem mo. After the review of literature, pwede pang i-enhance ang problem mo. After the review of literature, pwede pang i-change ang title ng study mo. Because it is the review of literature that will enlighten you if what is the available knowledge about this. Okay? That's why, guys, no? That's why I will give you this lecture, because I would want you to understand what's the purpose of literature review and what are the resources that you can access in the internet. Because internet is a very vast resource if you know how to access it. Pero kapag hindi ka naman marunong, kapag saan ka mag-a-access, okay, the internet lang siya. Okay? So, that's why we'll be talking about literature searches. So I placed here a picture of the library because I hope that you will continue to appreciate the value of the library. Okay? May mga bagay po na nandyan sa library na wala po sa internet. Okay? And in particular, those historical records, in particular, those publications published especially before 2010, a lot of them can be found in the library. Bakit ko po sinabi before 2010? Because studies would even show that from 2015 onwards, the trend already is on online publications rather than having the hard print. No? Rather than having the hard print, online publications na po yung naging trend natin from 2015 and up. Now, I'll be talking about literature searches, and basically I will be giving you an idea saan po kami kukuha ng literature when we are doing our research. Kasi sabi ko nga, di ba, by the time that we have defined our problem, the next step is maghahanap tayo ng literature. One example, class, of that literature is your SINAL. Okay, we refer to this one as SINAL. Okay, it's found in your reference text. What you can see on the screen is the screenshot of the website of SINAL. So your SINAL is Cumulative Index of Nursing and Allied Health Specialties, okay, or Allied Health. It provides authoritative coverage of literature related to nursing and allied health. Okay, so it's one that's your SINAL. The next one here is your Cochrane. You have your Cochrane library. Your Cochrane library is a collection of database that contain independent evidence on which to base clinical treatment decisions. And when we talk about your Cochrane library, it's more oftentimes used in, look at the keyword, treatment. Treatment decisions. Ibig sabihin, class, oftentimes, doktor po natin yung makaka-benefit sa reference na to. Okay? However, as nurses, we can get something out of it also. Okay? Now, class, in your Cochrane library, you will be able to see what are the clinical trials that are already available. Okay? If you would look at this class of methylphenidate for children with ADHD. If you can recall your pharmacology, methylphenidate is actually the drug of choice for ADHD. And now your Cochrane library has published an update or a review about the use of your methylphenidate, in the treatment of ADHD. Okay? You try to visit these websites, you can easily search on them. Then you have your MBase. Your MBase, which is your Exerta Medica database. It is a biomedicine database. Okay? One thing that you need to highlight there, biomedicine, and it's focused on pharmaceutical research. So later on, for example, if you will have your master's in clinical pharmacology, if ever you will pursue something in pharmaceutical research as a research assistant or a research investigator, okay, you can use this one as a reference, your MBA. Okay. Then you have your EBSCO host. Okay, class, your EBSCO host actually hosts. Okay, when I say host, it has also a lot of libraries within it. Okay, it has a lot of libraries within it. Okay, so it hosts several libraries across the globe also. Then, this one is your EBSCO, still under EBSCO, the one that we refer to as HAPI. Your HAPI is the Health and Psychosocial Instruments. Okay? So class, pag sinabi natin health and psychosocial instruments, look at the word there, instruments. Okay? So, ibig sabihin, class, it is a database of those that are used in medicine, okay, behavioral measurement tools in medicine, nursing, clinical personality, social development psychology. Ibig sabihin, for example, if gusto kong maghanap ng questionnaire on the risk for depression, I can go to this website. If I would want to look for the questionnaire for the happiness of my students, I could go to this website and check whether those questionnaires already exist. Okay? Then you have your OVID. Your OVID Medline is by the National Library of Medicine. Okay, your OVID Medline is by the National Library of Medicine. So it is the database still for the clinical or the healthcare fields. Medicine, nursing, dentistry, vet med, the healthcare system, and preclinical side. Then you have your APA Psych Info. Okay, you have your APA Psych Info. Plus, if you talk about APA, APA is American Psychological Association. Okay? APA is American Psychological Association. And when you talk about APA, plus your APA is talking about psychological sciences. Di ba kung na-notice nyo, kahit sa mga requirements sinasabi, make your requirement in APA format, submit your reference in APA format. Plus ito po yung APA na tinutukoy natin. Okay, that's your American Psychological Association. They are a very rigorous organization when it comes to psychiatric illnesses. Okay, in fact, they are also the author of your DSM-5-TR. Okay, your DSM-5-TR is Diagnostics and Standard Manual 5 Text Revision. Okay, allow me to check the meaning. I might misrecall it. Diagnostic and Statistical Manual of Mental Disorders. Okay, your DSM is diagnostic, and Statistical Manual of Mental Disorders. The V there is 5, and the TR is text revision. Okay, text revision. That's the latest one. When I was studying nursing, DSM-4-TR is still the one that we used. Okay? Ibig sabihin, class, when you will be learning psych, you will be using APA, DSM-5 as a reference. Bakit po? Dahil dyan po nakalagay, paano po madadiagnose na may depression ka? Paano po madadiagnose na meron kang anxiety disorder? Paano madadiagnose that the patient has schizophrenia? Okay, that could be found in DSM-5-TR. Okay, your DSM-5-TR. But please, dear students, don't read it and then over-conclude about yourself. Pag may problema po tayo, kumonsulta po tayo sa doktor, tayo po ay soon to be nurses, hindi po kayo magiging doktor. Okay, and even doctors class would consult psychiatrists if they would need help on this. Ha, huwag kayong mag-conclude, baka makita nyo, hala, hindi ako kumakain, hindi ako lumalabas ng room, may mga signs na ako ng depression. Okay, baka batukan ko kayo mamaya. Ha, huwag kayong magsi-self-conclude. I know we have the tendency to overanalyze our conditions. Okay, but on this one class, this one is APA Psych Info. That's one website of your APA, and its focus is on the researches on psychology and related disciplines. Okay, psychology and related disciplines. You know what? On the side, psychology is a very interesting topic to pursue on. Kaso, on the ethical approval, you will have difficulties. Okay, because undergraduate students are not yet capable of handling psychiatric research. So kapag gusto niyo mga mental health topics class, huwag kayong mag-focus sa depression kasi ang unang itatanong sa inyo is, anong gagawin nyo kapag depressed yung participant? Okay? In the same way sa mga patient na mga violence victim, so anong gagawin nyo kapag yung patient maging suicidal sa harap nyo during the interview? Okay? So hindi pa kayo trained for that. That's why usually professionals yung nagkakandak. So pag may mental health disorders kayong mga problem, you need to look into the ethical side of it, whether you can be capable to do it ethically or hindi pa. Okay? So yan. Pero class, another on the side, no? Even in the United States, di ba meron tayong nurse practitioners. A lot of nurse practitioners are already encouraged to pursue also the psychiatric specialty because of the noticeable need for this profession. Okay? Plus, if you feel sad, no? If you feel depressed, or if you feel anxious, hindi to para ma-comfort ka, pero you know what? Marami na talagang nagkakaganyan ngayon. Okay? We are becoming more aware kasi about it. And we are becoming aware that we need to address it. So a lot of people are having it, and they say that nurses are the best individuals also to help these people. That's why may mga specialty, no? So kapag makakapunta kayo ng US, mag-doctoral kayo doon, Doctor of Nursing Practice, and then try to make psychiatric nursing as your specialty. Okay? And that is if you're interested on it. Okay? That is if you're interested on it. Okay, just on the side. Now, another thing is Scopus. Another thing is Scopus. When we talk about Scopus, guys, we usually use Scopus when we would like to look for credible journals. Okay? Please write it on the side of your text. Okay? We use Scopus if we would want to look for credible journals. Okay? Now, for example, if I as a nurse researcher would be publishing my research, I would look into Scopus Index Journal. Okay, I would look into Scopus Index Journal, meaning I would look for journals that are reliable. I would look for journals that are strict in screening the researches that they are publishing. Because if you would look at it, no, I screen cap this from Google, it says that Scopus Index Journals is known to be the best abstraction and citation database for peer-reviewed journal. Ano pong ibig sabihin ng peer-reviewed journal? For example, lahat tayo nurse researchers na, no? Graduate na kayo at saka mga experts sa field nyo. Halimbawa, magsasubmit ako ng research ko on children with epilepsy. I had the research among children with epilepsy, for example. When I will be submitting that research to, let's say, for example, Christia, Joy, then LJ, for example, because you are the part of the journal, i-review yan ni Christia, i-review yan ni Joy, i-review yan ni LJ, pero they do not know that it is my research. Okay, they do not know that it is my research. Bakit? Kasi kapag baka makita ni Christia, hala kay sir, teacher ko pa yan nung college, nakakahiya naman kapag hindi ko to siguro i-accept. Okay? So walang bias. Dapat walang bias. And that is what Scopus is actually promoting. And when we publish research, it should be reviewed by peers. That's why the term peer-reviewed. Ibig sabihin, class, na check siya ng ibang experts sa field. Ibig sabihin na review siya ng other nurse researchers so that its validity before it will be published is already established. Eh, hindi pwede na ma-publish siya, tapos ayun pala yung study ko parang haka-haka, ano? Or ayun pala yung study ko parang hindi ko naman ginawa ng maayos. Okay, so that's the quality control, kumbaga, on the researches that are being published. And one of the standards that we use is Scopus, okay? Scopus indexed journals. Okay? So another one is Web of Science journals. As you can see, it's also a listing of the journals. And if you would try to look at it, there's a journal in pediatric nursing. There's a journal class in advanced emergency nursing. There's a journal in African Journal of Nursing and Midwifery. Basically, class, there are journals in several topics that we have in nursing. So that's how big, that's how vast our resources are when it comes to these nursing journals. Okay? And perhaps the most common that you have encountered, or the most common that comes out through your searches, is your Google Scholar. Okay? Google Scholar, admittedly, and by personal experience, is very useful. Okay? Now, one important tool here that you can use is the feature to limit the time range of the studies that you are looking into. So for example, in research kasi guys, we look into knowledge as something that changes every 5 years. So if I say recent literature in research, for example, right now it's 2023, I would want to see literatures from 2018 to 2023. Okay, especially if you're talking about modern topics to research on. Okay, so dapat yung literature mo from 2018 to 2023. So if ganong guide yung ibibigay ko, you can do the custom range and then it will be able to guide you na dapat 2018 to 2023 na. Okay? Google Scholar is among the widely used right now because if you will try to access some of the websites that I am scanning on the screen from Sinal, Cochrane, and Base EBSCO, okay, try to access it later on, you would notice that there are websites there that would entail payment. Okay, there are websites there that would entail payment. And, sir, paano po yan kapag gusto po naming mag-research? Class, you are not paying for it individually. Instead, it should be the library, it should be the school library, the university library who would get the access for the students and the faculty members. Okay? So pag gusto nyo po talagang mag-access, you can go to big universities. Okay, for example, I was managed to access almost all of this from the University of the Philippines. When I was doing my schooling in the University of the Philippines, we have access with this, EBSCO, Cochrane. Okay, we have access for almost all of these references that I am talking about. Okay, so if ever you would need to access these resources badly, you can actually contact these libraries, and the school where you are studying just needs to endorse to the other library that you need the resources, and hopefully they will be able to accommodate you. And going back, the benefit of Google Scholar kasi is that it's free access. No, free access siya kasi. Okay? Now, another thing is your Virginia Henderson Library. So you have what you refer to as your Virginia Henderson Library. Virginia Henderson, if you can recall fundamentals of theoretical foundations of nursing, Virginia Henderson is famous for, what is she famous for? Hindi sir, hindi siya sikat. Class, ano yung nilearn natin kay Virginia Henderson? When we talk about Virginia Henderson, ano yung theory ni Virginia Henderson? Or ano yung contribution ni Virginia Henderson? Bakit si Virginia Henderson nandyan talaga class sa inyong theoretical foundations for nursing class? Yes? Sige na, kahit mag-quick Google search kayo dyan. Anong contribution ni Virginia Henderson? Okay, the nursing need theory. Okay, good for mentioning the nursing need theory, although late ko na nga yan na-realize. Sige, ano pa? Excuse me. Okay, ano pa? Hoy, Virginia Henderson. Nursing need. Ilang needs daw according kay Henderson? Ilang needs daw according kay Henderson? Yes, the 14 basic needs. Okay? The 14 basic needs. And other than that class, Virginia Henderson is also famous for her definition of nursing. Okay? Her definition of nursing. that's covered in your TFN, please try to look into the definition of nursing by Virginia Henderson. And class, right now on screen, you are looking on a screen capture of the Virginia Henderson Library. Okay, the Virginia Henderson repository of online resources. Your Virginia Henderson repository is handled by STTI. STTI is Sigma Theta Tau International. Okay, Sigma Theta Tau International. We would usually say that STTI is the organization class for nurses who have influence across the world. So they are nurses who had, for example, honorary degrees. They are nurses, for example, who have been into leadership positions. They are nurses, for example, who have had influence. Okay? So class, the term for Sigma Theta Tau is the International Honor Society of Nurses. International Honor Society of Nurses. And if you would look at Sigma repository, it has a lot of researches done by the nurses across the globe. Okay? Sir, can we be members of Sigma Theta Tau International? Yes, you can all be members of STTI by the time that you graduate, and then by the time that you will conduct a research, or by the time that you will have a leadership position, you can apply to be a member of Sigma Theta Tau International. Among the members there, among our co-members there, for example, we have Jean Watson. Are you familiar with Jean Watson? Okay, Jean Watson as in the theories. Jean Watson, the theory on caring. Okay, I think Patricia Banner is also one of the members of Sigma Theta Tau International. So Patricia Banner, your novice to expert model. Okay, so if you would want to meet the big names in nursing, be a member of Sigma Theta Tau International. Okay, do you have any questions so far with those topics that we've talked about? Okay, so I hope that with that little introduction, you will be engaged more in your research activities, because you will be going towards third year. Okay, if you will be going towards level 3, the next problem that you will need to think of is that you don't have a problem yet. Okay, kumbaga, my teacher in research would always say, our problem is that we don't have a problem. Okay, that's always the introductory thing that we talk about research, that we talk about in research. Okay, so I hope that with that, we'll be able to use this literature features that are available. Okay, sige. Let's see.